As we explore the incredible range of health resources across the Garden State, it's become clear that even our full-length monthly episodes of Healthy in the Garden State can't capture it all. That's where this Dose of Health mini-series comes in. Every 2 weeks, we'll introduce you to inspiring individuals working to improve the physical, mental, and emotional well-being of New Jersey residents. In each brief conversation, they'll share practical tips, personal insights, and how you can connect with them to learn more. I'm your host, Kate Cherichello Tente, and I'm thrilled to bring you these individuals creating positive change in our communities. Don't forget to subscribe on YouTube at Healthy in the Garden State to catch every new release, and visit healthyinthegardenstate.com for even more health-forward resources. Emily Longero is a fourth-generation nurse with over 16 years of experience in pediatric, adolescent, and young adult oncology. She is the founding adolescent and young adult nurse practitioner at Memorial Sloan Kettering Cancer Center, where she cares for patients ages 15 to 39 through diagnosis, treatment, and survivorship. Beyond her clinical work, Emily is passionate about prevention and education, helping people reduce their cancer risk through everyday lifestyle choices. She's also a proud wife and mom to 3 little girls, and together they love exploring the best of New Jersey. Emily, when I first learned about your work, I was really struck about just how meaningful it must be for your patients to have you on their team, but also how emotionally demanding that this path could be. So can you share with us, what led you to choose oncology care, and maybe what it feels like on a personal and emotional level to walk alongside patients through these journeys?
Mm-hmm. Yes, so thank you so much for having me. It is an honor to be here. I will tell you, I think that my path that led me into oncology was a bit of a kismet connection, kind of the universe putting this out there for me. When I was 9 years old, my grandfather was diagnosed with a terminal stomach cancer. And so I'd always been just intrigued by hospitals. I come from a long line of medical providers. And so being there and witnessing my grandfather, going through his terminal cancer care, it really showed to me the impact that healthcare providers and supporters have for patients and families. So then when I was going into nursing school, something was just kind of, pushing me to apply for oncology positions. I've always had a passion for being around children and taking care of children. That led me on to pediatric oncology. And then while I was there on this inpatient unit, it was the teenagers and the young adults that I just felt this connection to. It's complex, it's dynamic. They are already going through so many changes and now get a cancer diagnosis, and their entire lives are just, put in a blender, so to speak, and trying to figure out how are they going to navigate through all of this. And you're right, it does take a toll on providers. And we owe it to ourselves, we owe it to our patients to take time to figure out how can we refill our cup. Hearing so many stories and so many experiences of patients, and it's so important for us to bear witness to what they're going through, to validate all of their emotions and concerns. And so being an empath that I am, I often take on a lot of that. So I will be sure that I'm stopping and taking a breath. Maybe I need to go in between telemedicine visits with patients and take a quick breath outside, just to take a deep breath, kind of feel the sunshine on my face for a moment. Be grateful. Gratitude has a huge role in this. And then also time outside of work, so time with family, taking yoga classes, really finding ways to move my body, to be in my body, and just be grateful for all that I have and all that I'm able to provide for my patients as well. I'd like to also note that all of my opinions that I shared today are my own.
It's just incredible to me when people are in a line of work like your own just that you take it on every day, and that you're still able. I mean, look, when I met you, Emily and I connected through one of our episodes, actually. You might see her pop up in episode 4, and her adorable little one. But Emily just has such a lightness to her. You really do, Emily. And so it just was incredible when I said, wow, every day you're dealing with such, potentially heavy. It's not all heavy, there's also the success stories too, but oftentimes heavy aspect and a very specific population. Are there any things that you want the general public to learn based on what you've encountered in your years of practice?
Yes, thank you. So, more than 85,000 adolescents and young adults are diagnosed with cancer in the United States every year alone. And so that really got me thinking, wait a minute, these numbers are rising. How is it that we're seeing more young people in their 20s and 30s, being diagnosed with colorectal cancer or breast cancer? What can we do before we get to that point? Is there anything we can do to help prevent our risk of getting cancer? So I really feel the need to educate people, the general population, about things we can do throughout our daily choices. What foods are we eating? I always recommend a Mediterranean diet-esque, right? Like there needs to be a bit of give and take here, a little bit of flexibility. We don't want to be so strict and stringent in the recommendations. So lean proteins, minimizing the amounts of processed meats or alcohol that we're ingesting. Whole grains are really important. Minimizing the amount of processed foods, snacks, sugary foods that we're having. But we need to have a little bit of joy in our life. And if food gives you that, then please enjoy a little bit. Just being mindful of the things that we're putting in our body. Of course, olive oil, avocados, those healthy fats can go a long way too. And then movement, exercise, and it doesn't need to be super strenuous, but 150 minutes of moderate exercise per week. I mean, that's 30 minutes most days, right? And that can be walking. That can be some moderate strength training, because that will help with bone health. But diet, exercise, and then stress management and sleep play a huge role in hormone regulation, in DNA repair, and all of those things are needed to help decrease the risk of cancer. Another huge point that I'm passionate about is what not only are we putting in our bodies, but what are we putting on and around our bodies? And this can be anything from the cookware that we're using, the storage containers that we're storing our food in, our body lotions, face serums, all of that. And so it's really important to understand the labels that you are able to read for food, for cleaning products, for skincare and body care, so that you know to look out for things like fragrance. Fragrance is a loophole in the United States where we do not have as many regulations as, let's say, Europe. And so manufacturers can put phthalates, PFAS, which are forever chemicals. So these are ingredients that could potentially be disrupting our endocrine system, be potentially leading to an increase in cancer risk. You can use apps like the EWG app or Yuka app to look at what are the ratings. So that way you can find products and brands that you trust that follow cleaner, more ethical practices, so you can feel confident about what you're putting in, on, and around your body. I've also partnered with a holistic skincare brand called Olive Tree People, and this is based off of hydroxytyrosol, which is an antioxidant. So there are ways that you can really be nourishing your body inside, from topical and what we're putting on and around our body, and then of course movement, exercise, stress management, and I think all of those things are what's important to help live healthier lives and to decrease our risk of cancer in the future.
Yes, yes, so much important information right there. I encourage anyone watching to just click that rewind and go back and watch that part again for sure. Because the other aspect I know with my clients in the fitness space, it's a lot of, well, I feel overwhelmed or I don't have time to do all this. And there's the nice response and there's the more blunt response. I feel like the blunt one is, well, going to a hospital takes a heck of a lot more time than reading a label. There's that extreme, but also just the idea of if we find time for looking at Instagram or we have time to watch the news or a television show, then maybe we have time to flip the box over, read the ingredients. That is the first thing we should be doing when something, that we get from a box, what we should be doing with it. And that idea of, yes, reading the ingredients on what we're putting on our body instead of just in our body. Absolutely. Thank you so much for saying that and making the time. It's in short bursts. It adds up immensely. It takes a lot of time to read labels when you've never read a label before, but after a while, you don't have to read it anymore because it's the same thing you buy or what's in that at that point. And the exercising aspect, adding it into our day, parking a little further away from the store, these maybe seemingly small things really add up so much. So I can't thank you enough for saying that. I know I'm always telling clients, every bit counts, because it really, really does.
Little chunks, little changes we can make along the way. You do not have to completely revolutionize your life here because that often is not attainable and you won't stick with it.
Absolutely. And are there other ways, maybe phrases you use or just some visuals to help people take the overwhelm out of all the information to digest that is out there?
I would say start slow or start low and go slow. That can be, even 15 minutes of exercise. And then you can work that into your day and then you can increase it. Add in a little bit of weight training a couple days a week. Take that 15 minutes and move it to 20 minutes, 30 minutes. And by working things in and making it become a habit, you are so much more likely to be successful and to stick to it. And that's when you have those lasting impacts.
Yes, the starting slow and low. That's great. Get the habit and then it builds. Absolutely. Now, Emily, when you do meet someone who's facing a cancer diagnosis for the first time, is there something that you tell them? Is there something that their family or friends can do? Just something that you find that seems to be very helpful in supporting someone with a diagnosis? Because I'm sure that someone listening is facing that, if not for themselves, for a loved one.
So in my practice, when I am caring for somebody, my goal is really to see them as a whole person. It is not just a cancer diagnosis that is now defining somebody, although that is part of their story. So for caregivers, what I would say is be a listening ear. Don't feel like you have to have all of the words or all of the answers for somebody. Ask them how they're feeling. And even if they're not open to talking or don't have the words, being there and even just sitting with somebody can make a huge difference. I think that when somebody is diagnosed with cancer, mental health is a huge component. The changes to their relationships, be it intimacy or parenting, work, all of that can take such a different shape. And so being there for your loved one or friend can make a huge difference in how they're processing all of this and helping them feel seen beyond a cancer diagnosis.
Emily, is there anything you can share with us regarding early intervention and prevention regarding cancer?
Yes. Cancer typically is much more successful in its treatment and cure if it's caught early. So a few things that are very important to consider and to put into your life are cancer screenings. So for women or females with breasts, mammograms starting at the age of 40 for standard risk people. If you're somebody that has a gene that might make you more susceptible or have an increased chance of cancer, or if you have a strong family history of cancer, then you can talk with your provider about having a mammogram done earlier. In terms of colorectal cancer, getting a colonoscopy starting at 45 years old, and other cancer screening like cervical cancer screenings through pap smears that starts as early as 21 years old. And then just making sure, even for you, when you get out of the shower, checking your skin, looking to see, are there any changes to moles or new dark spots that you're seeing, so that you are aware of any changes in your body and you can seek medical care as soon as you notice a change.
This was wonderful, and I can't wait to share it. And again, like, I'm serious. Thank you for what you're doing. I'm just
Oh,
my
thank you.
getting my brain around all of it. It's wow. It's a lot.
Thank you. This was
Thank you.
wonderful. Thank you so much.